Now let's answer this question here. Can you contribute to an HSA while on Medicare? Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid making Medicare mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is all about HSAs. HSA stands for a Health Savings Account. Now, as I get into the topic today, I do want to remind you that I'm not talking about FSAs, which are called Flexible Spending Accounts, or HRAs, which are Health Reimbursement Arrangements. So this video has only to do with HSA Health Savings Account and what you need to know about HSAs and Medicare. First of all, what is an HSA? That means that somebody is still working or their spouse is still working, and that employer has what we would call a high deductible health plan that qualifies to add to that a HSA option, which means that someone can contribute money to their HSA. It's like a healthcare IRA, and as they put money into that account, that money goes in pre-tax. It's not taxable money, and as long as that money is going to be used for present or future medical expenses, there's never any taxes that have to be paid on that money. So these are tax advantage plans for people to be able to save money for present or future healthcare expenses. So that's an HSA. Now let's answer this question here. Can you contribute to an HSA while on Medicare? And the answer is no, you can't. Once you have any form of Medicare, you can no longer contribute to an HSA. So if you're enrolled in A and B, you should not be contributing to an HSA. Once A and B goes effective, no new money can go into your HSA. Now, the HSA money that you put in is still yours, for sure, but no new money can go in once you're enrolled in any form of Medicare, including Part A only. People oftentimes are still working or their spouse is still working, and they're covered by employer-provided plans that they're going to use for their insurance, but they hear that they're going to have to enroll into Medicare A, and so many do. And so it means they're still working, covered by a group plan, but they enrolled in A only. So when they get a Medicare card, it says Part A only. So if someone has A only, should they contribute HSA? And the answer is no. Again, any form of Medicare, you have to stop your contributions to your HSA. So the next question is, when is Part A required? Now, listen, for most people, you need to be on A and B. If you're in this situation where you're turning 65 and you're on a retiree plan, you're enrolled in A and B. If you're turning 65 and you are covered by COBRA plan, you have to take A and B. If you are on an ACA plan, Affordable Care Act plan, again, you're going to enroll in A and B. You're not going to stay on that ACA plan. Or if you're in a group of 19 people or less, in other words, you're still working or your spouse is still working, and there's 19 people or less in that group, you need to be enrolled in A and B. So again, that's many, many people. But anyone who is covered by a group plan of 20 or more insureds, this would be your coverage at work or your spouse's coverage at work, if you're covered by that group plan of 20 or more, you don't have to do anything with Medicare at all. You don't have to have A and you don't have to have B. But if you decide to take A because you've heard you'll be penalized if you don't take it, then you have A only. No new contributions are going into your HSA. So people that are still working or their spouse is still working and there's 20 or more people insured in that group, they don't have to have A or B. They can stay on the group plan without any form of Medicare, all right? So when is it required? If you're on Social Security, you were automatically enrolled in A and B. Now, if you had a group plan option, you were able to disenroll from Part B, but you had to stay enrolled in Part A. So anyone that's receiving Social Security should not be contributing to an HSA because you have at least Part A. If you have A and B, again, no new money is going to go into your HSA. And just so you know, right now, this year, those of you who are contributing, you can put in $3,650 a year. If it's a family HSA, $7,300. If you're over 55, you can add an additional $1,000 every year. That's called a catch-up. So those are very nice plans. It goes in pre-tax and again can be used for present or future medical expenses. Now, one thing I want to note that's very, very important, and that's this. When you enroll into Medicare, what happens? Let me just give you the example. Someone, they'll say they're going to work until they're 67 and they decide to enroll into Medicare A and B at that time because they've been contributing to their HSA. Once you enroll into Medicare, A or B or both, what's going to happen in that scenario, you're 67, they're going to backdate your A date 6 months from when you applied. So technically then, when you know that a date is going to start, you should no longer be putting any money into your HSA. And a lot of people get confused by this because they'll read that you need to stop your contributions 6 months prior to your retirement. Truth is, you ought to stop contributing 6 months before you apply for Medicare, because from that application date, they're going to backdate your A date 6 months. Now, they'll never backdate before 65, but they go back 6 months or to 65, whatever's the soonest on the A date. They will backdate that A date. And so no new money can go in once you have had Medicare Part A or B or both. All right. And then thirdly, let's talk about this, what that can be covered or what services can we use our HSA for? It's very specific. You'll see you can use it for a lot of things, but not everything. So the question, how can HSA funds be used, this money that you put in pre-tax? First off, you can actually get reimbursed for your Medicare Part B premiums. This is 2022. Right now, that Part B premium is $170.10 a month. You actually can pay your Part B premium and you can be reimbursed right out of your HSA account for those Part B premiums, including the Part B deductible. Many people today have supplemental plans and they get the Plan G or the Plan N, and both of those carry a deductible, $233 this year. So you can pay that B deductible out of the G plan or N plan from your HSA. So that's a very nice benefit. You also, if you have a Part D plan that's separate, it's a separate premium, you can pay that premium with your HSA or get reimbursed from it, and all your prescription drug copays, including deductibles. Right now, we have a drug plan deductible, $480. That $480 can be reimbursed to you right out of your HSA and your copays along with that as well. So that's very nice. And then Advantage plans. Some of you will opt for an Advantage plan instead of a supplemental plan. And sometimes those Advantage plans carry some premiums. You can pay those with the HSA and all your copays, because the majority of services on Advantage plans are going to have a copay. CAT scans, MRIs, outpatient surgery, hospital stay, all that money that you need to have in copays for your Advantage plan can come out of your HSA. And then lastly here, miscellaneous medical expenses, dental expenses, vision, hearing, all those kind of expenses that may not be covered by your plan, they can be covered then by the HSA. The only thing you cannot pay out of an HSA, you'll notice here, are supplemental monthly premiums. There's also called Medigap. So supplemental plans, Medigaps, that's synonymous, but you pay a premium for those, and that cannot come out of your HSA. But as you can see, everything else other than Med Sup premiums can come out of your HSA. All right. And so HSAs are wonderful accounts. I would encourage you, if you keep working past 65 and you're in a group of 20 or more, or you or your spouse are working, I think the advantages of contributing to an HSA far outweigh of enrolling in Medicare A only, because in those large groups, Medicare is only going to pay second anyways. Your employer plan will continue to pay first. Okay, so if you have an HSA, keep contributing to that. But once we go on Medicare, any form, A or B, no new contributions into your HSA.
Hey, thanks so much for watching the video, and I do hope that it was helpful. Now, if you feel like you need to learn more about Medicare to make sure you're making the right Medicare decision, really the best way and the easiest way to do that is to go to MedicareSchool.com. That's MedicareSchool.com, and you'll be given the opportunity to click on Get the Free Workshop. We call that the Essentials Workshop, and I do all the teaching, and there you'll learn all the ins and outs of Medicare to make sure that you have an accurate and thorough understanding of how Medicare works. The second thing you can do is click where it says Talk to a Medicare Guide, and there you can actually set up a time where you can discuss your situation with a Medicare guide. They'll explain all your options, and they'll actually even walk you through the enrollment process as well if that's what you need to do. And so go to MedicareSchool.com, watch the workshop, or talk to a Medicare guide. It would be our privilege to assist you further.